Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time.
Welcome to the Brain People Podcast. My name is Jonathan Edens. I am your host for today. I'm a psychiatric PA, and I'm joined by a very familiar face, but equally special to all of our other hosts.
Hi, everyone. My name is Dr. Katie Cruz. I'm a licensed clinical psychologist.
So today we are going to be discussing a very, I'd say, popular topic in mental health. This is something that is somewhat incorporated to a lot of different psychotherapies. And so I think the conversation will be definitely helpful to a lot of our listeners. Really, no matter what sort of mental health symptoms you're dealing with, there's definitely a takeaway for just about anybody. So Katie, why don't you go ahead and share with us what we're going to be discussing today?
Yeah, so we're going to be talking about mindfulness. Mindfulness, what it is, how do I increase it? And really, those are going to be the main components, but I'm sure there'll be other kind of offshoots from that. So
mindfulness is somewhat of a buzzword, in the mental health community, especially, I also say outside of sort of the professional community, especially, on social media and so on, it's definitely being used a lot. Why do you think that is, Katie? What has garnered sort of so much attention around this particular concept?
Yeah, great question. I think a part of it is because on a global level, societally, we're living more mindless in general. And so it's like, whether it's before it may have been very specific to certain populations, but it's now like, we need it for everyday living. We all need it. And it's kind of trying to push back on a culture in which we're living very mindlessly.
So for those of us that may feel at times that we are being a little mindless, or we're just sort of ebbing and flowing through life, right, without the degree of awareness that we're really hoping for, what are some ways in which we could do a self-assessment to determine how mindful we're actually being in our day-to-day?
Yeah, so I will just give some examples, and really these could apply to any part of your life. And I'll try to emphasize the most common examples. I'll start with the one that I am guilty of. When you're driving and you get to your destination and you can't remember the last 5 minutes of your drive, or sometimes this is quite scary.
The entire
the entire trip, or I don't remember if that was green light or what color that light was. That is an example of mindlessness when you're driving and you're kind of on autopilot in those moments. So that's driving. And when you're showering, there are people who are showering and they're mindless, and then they don't remember, did I already shampoo my hair? And sometimes they might do a double take because they just don't remember. You're not.
I forget that one a lot.
I'm sure you do, and the conditioner as well.
For those that are listeners, I'm bald, so hence the joke.
Yes.
If you're not watching the video,
I'm glad you clarified. Yes, and if for those who are not watching, I definitely do not have that problem.
Issue.
Yeah. So driving, showering, and then let's say with conversing, you're talking with someone, and if you're not mindful, you might be thinking, "What do I say next?" Or you're thinking about your grocery list. Sometimes even in therapy, I need to be making sure that I'm fully mindful, because if it's very easy for us to be distracted even internally and be wandering in our minds while being physically present, you're not mentally present. And so that might be in conversations. It also might happen while reading. I hear a lot of my patients talk about, I'll be reading a book and I don't remember what the last paragraph was about. And so, or paragraph or sentence or however much they just read, and they have to go back, and sometimes over and over and over again. And then another common one is losing things or forgetting. Some people are like, I have dementia. And for some people, you can't rule that out, but others, it's very linked to stress, anxiety, and mindlessness, where they walk into a room and they say, I don't remember why I came here for what I came here for, or I keep on losing my keys. I've had patients where they say, I forgot my water bottle here, and then I forgot my keys here, and I lost my wedding ring. And it's just an over kind of a permeating mindlessness in different areas of their life.
So if that is mindlessness, what exactly is mindfulness? Could you give us a definition of sorts?
Yeah. So if you think about, I think people could generally picture mindlessness. So mindful, right? Having your mind full is you're living intentionally aware of the present moment. So, and I like the word intentional because it's not, you can think about mindlessness being unintentional, and then awareness of the present moment.
Okay. Seems simple enough, at least from a definitional standpoint, but I imagine it's more than that. Can you elaborate a little bit more for us?
Yeah. So I think that's the main definition, but there's kind of some additional components of you don't have attachment or judgment of the moment. And that's really important because many times, if you're trying to be mindful, let's say, of your thoughts, you're like, oh, that's a negative thought, and you immediately push it away. That's not mindfulness. You're not just staying with it. You're not being present with it. You're rejecting the moment. That happens a lot with our emotions as well, where you feel an emotion and it's uncomfortable and you immediately push it away versus observing the emotion, sitting with the emotion. So there's rejection. So mindfulness is, being aware in the present moment without rejection, but also without attachment, where some people are so attached to the moment. And instead of just saying, I am a observer of this moment without any particular action quite yet. Now, it's good to take an action, but that would come after mindfulness of the moment.
So it's awareness and acceptance. So we'll say an acceptful awareness
Mm-hmm. Yeah.
in a way without attachment.
And I like this. I once heard this and it just stuck with me. It's living awake. And I love that because I think if you picture how we're kind of living today, like the rat race, is we're living dead, right? We're zombies in some ways. We're doom scrolling. We're just not really present in the moment. You sometimes look at people in the waiting room or people at the mall, and are we really living awake, right? Eyes wide open, fully present. And that's a simple way of defining mindfulness of living awake.
So we've talked a little bit about mindlessness. We've talked a little bit about the definitions of mindfulness. Sometimes it's helpful to really sort of be clear in what it is not in order to understand what it is fully. So could you tell us a few things about what mindfulness isn't in order to give us a better understanding as we continue on with this conversation?
Yeah, so we'll break it down into the different parts of the definition. So the living intentionally with awareness in the present moment. You think about what it's not, it's the autopilot. Some of those examples that I gave. If we're living intentionally, we're not just going throughout our day on autopilot and kind of just on that autopilot mode in which we're not making conscious choices. We're not consciously being aware of what's surrounding us, both externally as well as internally. And that's important to note because I think sometimes when people start doing mindfulness exercises, they're thinking that it's only external. I'm aware of my current present surroundings, but mindfulness also applies to being presently aware of even your internal environment.
That would be, just to clarify, that would be like bodily sensations, emotions,
Thoughts.
those types of things, thoughts.
Mm-hmm.
Okay.
Yeah. And one thing, and maybe we'll have a whole episode on this because a lot of times mindfulness gets confused with meditation. And there's kind of there's been an evolution of using different terms to mean different things. And, there's Eastern practices of meditation. Now there's Western practices. And it's important to distinguish mindfulness. And I know that some Christians even have fear of the word mindfulness because they're associating it with other religious practices. But it's important to note that mindfulness is just as we defined it. And really, it's not in some ways, it could be the opposite of meditation from the definition of emptying your mind. Mindfulness is, as it says, mindful. It's filling your mind, not emptying your mind. Now, some people use loose definitions of mindfulness and they may include it, but when we're looking at the truest definition of mindfulness, it's filling your mind, not emptying your mind.
Okay. I imagine the things that you fill your mind with through the process of mindfulness is going to be very important because somebody might counter and saying when I'm doom scrolling or let's just say when I'm scrolling TikTok or social media or whatnot, I'm filling my mind with the things that I'm watching. How is that a bad understanding of what mindfulness is?
Yeah, I would first challenge that a little bit and say, okay, tell me exactly what you watched and for how long did you watch that? And describe it more. And the fact alone that they, and not just they, have done it too, where you say, how long have you been on the phone for? And it's like, oh, I don't know, maybe 10 minutes. And it's not 10 minutes because they're not really mindful. And even if we were to do kind of a deeper discussion of what happens in your brain is not mindful. It's not really activated. Now, if you say, I am watching a show for 30 minutes that I really enjoy and I am really being mindful, that can happen. But the example of doom scrolling, like, is your mind really full or is your mind just barely occupied at that moment? It's kind of like you could watch a 30-minute show sitting in front of it, enjoying it, or I'm watching the show while cooking and doing other things. It's not really mindful.
Yeah, it's an intentional direction of your attention, right?
Yes.
And so, for somebody, they can definitely be mindful while they are on social media or watching a show. But the key component there would be the level of intentionality. Have you chosen, in the moment, or I should say, maybe even prior to, how long I'm going to be doing this thing before I move on to the next activity,
Yeah.
and setting and having boundaries right around certain types of unproductive behaviors. So was there anything else about what it is not that you wanted to mention before
Yeah,
we moved
because
on?
another pushback people say is not just, maybe I am mindful of the things I'm watching or consuming, is sometimes people say, I'm too mindful. And this is where what they describe is they're super aware of everybody's actions in a room. They're super aware of people's emotions. And they're like, how is mindfulness good if I'm too aware and that overwhelms me, that often overstimulates me? And that's not mindfulness, that's hypervigilance, right? Where if you really think about it, you're not really being in the present moment. You're not really participating of the moment. You're trying to control it. And that's the element of without attachment. That's why that component is really important to know. It's yes, being present, but it's not with rejection, not with attachment. And a lot of times people, when they say, well, I'm too mindful and I want to be mindless, and that's partially why we have a culture of mindlessness, is because we have issues with anxiety and hypervigilance and overstimulation. And so we take the other extreme of fully disconnecting, where we don't realize there's actually a better option, a balance where I could be present and still regulated and still not overly stimulated.
Yeah, that hypervigilance is common in those that have, say, panic disorder or post-traumatic stress disorder, right? And you mentioned that idea of the attachment to the environment. In that scenario, right, there's also just a lot of judging and rejection of that environment too. And so the judging might be on others; it also might be placed on yourself, right? You might be feeling the physical symptoms associated with the hypervigilance. We can also we'll call it anxiety too, right? A lot of people are overstimulated and they perceive that to be anxiety. And so, part of the problem of chronic anxiety is the judgment that you place on yourself for having those symptoms. And so that's if that is the case, then you're definitely not being mindful in that situation, right? So why is this important? Why is this concept of mindfulness important for mental well-being?
Now, we could probably even have a whole episode on this because there's just so much research out there. There's so many benefits, right? Linked to less depression, less anxiety, less trauma symptoms, and basically fill in the blank of the disorder. more relaxation. So maybe you don't even have a disorder, but it can help with more relaxation, less physical complaints too. I sometimes think about the benefits of mindfulness for health anxiety, right? Less reactive to difficult situations, improved relationships. That's a huge one. We forget about mindfulness in the context of relationships. Better focus and concentration. We see that that's a big component of multiple different types of disorders. And then there's a host of different things, but I want to capture it in the idea of empowerment. And this is really important because a lot of mental health disorders, there's an element of helplessness. And I actually want to do a whole episode on it because it's very prevalent. This I'm helpless or powerless. And mindfulness gives us a sense of empowerment. Well, actually gives us empowerment. And so there's that in itself is a huge benefit for us as individuals, as well as people who are struggling with mental illness. And
Okay.
I wanted to mention some quotes with this because I think it captures some of those benefits. This one is really popular. If you're depressed, you're living in the past. If you are anxious, you are living in the future. If you are at peace, you are living in the present. And so that captures the benefits of mindfulness of if I'm living in the present, peace is a natural kind of byproduct of that. And then another one, which I want to comment a little bit more about, is by John Kabat-Zinn, which is the founder of mindfulness based stress reduction clinic. It says, the only time you ever have in which to learn anything or see anything or feel anything or express any feeling or emotion or respond to any event or grow or heal is this moment. And so if you think about one huge benefit of mindfulness is all you have is the present. And I mean that in two ways. All you have is the present to experience joy, but also all you have is the present to also feel the unpleasant, the present to feel the unpleasant. And what that means is then you only have this moment to fix the unpleasant. But what people do is they focus on the past, which they can't control. They're so worried about the future, which they cannot control. And then they miss the opportunity of today to actually make a change that could then improve their life. The Bible also has this kind of idea, which I often will just whether you believe in the Bible or not, it's a wise saying. Do not worry about tomorrow, for tomorrow will worry about itself. And this is my favorite. Each day has enough trouble of its own. Right?
Inspiring.
Right?
Thank you.
It's so true. And it emphasizes mindfulness from the perspective of today has its problem, deal with it today, and today is all you have.
Yeah, really good reminder. So I think we've touched on this a little bit, but could you go into a little bit more depth about what really the purpose of mindfulness is? So we have a definition. We know it's good for us, especially for our mental well-being. But what is the goal of mindfulness exactly?
Yeah, so I did allude to it earlier. The goal is empowerment, recognizing that we have a choice. Every single moment is filled with choices. Do I attune to this person in front of me or do I attune to my phone? Do I attune to this heart rate increasing feeling that I'm getting and do I choose to label that as my heart rate is going up or do I choose to label that as I'm going to die, I'm having a heart attack? Mindfulness really gives us a sense of empowerment and helps us recognize that we have choice and every moment is full of choice. And this is where, again, the mindlessness of autopilot is saying, I have no choice. I'm kind of a victim to life versus saying, I can take control in my life and choose every single moment how to live it.
Yeah, that sounds very, very empowering. Are there any specific examples that you could give us, when it comes to how you could be maybe more mindful throughout the day?
Yeah. So when I think about some of my patients that lack mindfulness, oftentimes I see, for example, they're ruminating about something that they did 10 years ago or something that they did 10 minutes ago. And that is taking away from their opportunity to change whatever they want to do today. And mindfulness, how it looks practically, would then say, okay, that is something I can't be mindful of. That's something I can't be, attuned to and control. What can I do instead in this moment that I can take what I learned maybe from the past and then apply it to the present? And I would say, in regards to relationships, how do I engage more in mindfulness in order to improve those relationships today as well? Because a lot of times we regret things in relationships, but we don't realize, and this is kind of a thing we talk about in marital counseling, it's not about the absence of conflict, it's about how quickly you remedy it. And so
Yeah.
some people perseverate on the things that they've done and the regrets that they've had in their relationships, but the moment that they have right now to remedy it, they're missing out on it.
So, if we're convinced that mindfulness is good for us, what are some steps that we can take to increase it? You mentioned it was a skill, right? So, it is definitely something that can be improved upon. So, what are some of those to big picture things that would be generally applicable to most, if not all, of our listeners?
Yeah, so I think it's helpful to divide it into three main things: observe, describe, and participate. And these are found in DBT, but really can, it goes beyond DBT. So observe, if you think about observe, and even with each one, we can also apply it internally and externally. Observe. And this is a very passive kind of activity of like, you're not labeling anything, you're just kind of taking it in, right? Observe what's happening outside yourself. That's the first kind of step of mindfulness. So if I'm trying to think about right now what's going on, what's helpful is using your senses. So think about your five senses, and you can use that to observe. Non-judgmental observation, just taking it in. Inside yourself, you can observe your thoughts, your feelings. We talked about these, your body sensations. And so, for example, before you start, freaking out that you're having a panic attack, you might just observe my heart rate is going up,
Mm.
right? So it's not jumping to any conclusion. It's just observing. And by observing, a big part of this is it becomes less threatening if I'm just observing what's happening, right? Number two, describing. This is where we put words, we use language to describe what we're observing. So with thoughts, for example, I love this practice. You also find it in ACT therapy, acceptance and commitment therapy, of
Yeah.
instead of I'm so stupid, you'd say, I'm observing, right? That I'm having a thought that I am stupid. And what does that do? How does that sound different to you if someone says I'm stupid versus I'm having the thought that I'm stupid?
In the former, right, when you have the thought of I'm stupid, you're specifically identifying with said thought, right? Versus the latter, you're creating a degree of distance in between. And so you label it as it's a thought that I'm having versus an identity that I'm associating with.
Exactly. And I just love it. I love this because it's putting space between you and a thought. It just, hey, this thought is here. And that can apply also to any emotions. And I tell people to not just quickly even label the emotion. The describe part is describing it. Do I
Mhm.
feel a pit in my stomach? Do I feel a warmth in my chest? Whatever it may be. And then part of the using your senses is you could describe it very specifically. This is really helpful for mindfulness. So often when we do nature mindfulness exercises, often people will say, I see leaves, right, on a tree. It's like, no, be more specific. Be very present in the moment. Okay, I see green leaves in this particular shape, right? It has this type of texture, really describing the specifics. And that helps. We can talk about this later briefly about grounding. It helps to be
Mhm.
very specific. So, what you're doing is you're really zoning into that experience. If you're with people, describing who am I with, and if I'm with my grandma and I hear her big laughter, and you're really immersing yourself into that experience. So describing would be labeling what you observe and using language without judgment, just language to describe in a factual manner. And then the last one is participating. As you observe, as you describe, then you participate. And what's important about participation is to be fully present, not separating yourself from what's going on in the moment. So if you're feeling happy and you observed and described that, then participate fully. And DBT, they'll give some examples like if you're feeling happy because you're listening to music, allow yourself to fully dance or move around or do whatever it is to really immerse yourself in that experience. If you're feeling sad though, because some people are like, okay, I can do that when I'm feeling happy, but sadness, I don't want to experience. It's actually important to be fully participating in also the sadness. This is where we see, for example, with grief, it's really healing to allow yourself to fully express. We know that there's a cathartic element of crying, and that stress hormones are released as you cry and so forth. And so once you observe and describe, I'm feeling sad, then it's important to participate even in that. And then whether
Can we before it real quick,
Yes.
can we clarify a little bit? This is not what we're describing because I'm thinking sort of the counterpoint of somebody dealing with say depression
Yeah.
and thinking like, well, so Dr. Katie is saying it's good for me to be depressed, right? And what we're saying is we're not necessarily wanting to fully accept the presence of depression per se, right? But be more accepting that you will experience, negative emotions. And so this process of accepting that reality and not necessarily just immediately sort of resisting the fact, right? Whatever that reality is, it's a little bit like the analogy I like to, or the metaphor I like to use often is like quicksand, right? The more that you fight against the quicksand, the more that it can actually harm you. And so we don't want you to stay in the quicksand, right? But we do realize that oftentimes if you just resist and you fight in sort of an aggressive way and you get down on yourself and feel guilty for feeling the way that you do, rather than just sort of accepting the emotional state and being mindful of what you're currently experiencing, then yeah, your recovery is not going to be as good.
Yeah. And I'm glad you clarified that because, these skills don't stand alone. So when we're talking about these, participation in emotions, it's really important that those emotions are valid. And I don't mean, I have my whole spiel about all emotions are technically valid, but it's the thoughts behind them. And so if your thought behind a sad feeling is, oh, my life is terrible and my future is hopeless, woe is me, and that's not true, then you wouldn't be fully participating in that emotion, right? And exacerbating that. But let's say you just lost your dog. And that's where people suppress and avoid and try to reject that moment. And it's like, no, those are natural feelings that you do need to express. So I'm glad that you clarified that. And then, with actions, this is one part of mindfulness that I'm super passionate about. We really need to be fully participating in life. If you are with someone, I once heard, and I thought it was a great example, but it's true. If I'm hanging out with you, Jonathan, and then I'm texting Hicks, right? And then when I'm with Hicks, I'm texting Jonathan. I'm not fully present. I'm always wanting to be somewhere else. And so if you're swimming, fully swim. Don't be thinking about other things. If you're, with someone, be with them fully. If you're on your phone, be on your phone. And then once you're done, then go to something else, right? And this is important because a lot of times people think, oh, I can multitask. And it's this illusion that, it's good for me and it's, I'm being productive. But you're actually, they say only 2% of the population can actually multitask. So what you're actually doing is two things not fully well. And so mindfulness living is really important of fully participating in what you're doing. If you're driving, drive, listen to the radio, whatever you're doing, be fully participating in those actions.
So I wanted to discuss a particular example. I was hoping that maybe we can give kind of a practical example of using mindfulness in an acute situation. That's ACUTE, not something that's adorable, but an acute symptomatic situation, particularly with anxiety, because I know a lot of our listeners do tend to deal with anxiety. And so how might somebody incorporate a mindfulness practice in a situation where they are starting to feel their thoughts racing, they're starting to work themselves up with worry, maybe they're starting to have symptoms of panic, right? They're feeling uneasy and physically tense, maybe they're getting a little shaky or sweaty. So in that moment, what might be a mindfulness based practice that they could do to help alleviate some of those symptoms?
Yeah, so I'll give two examples and two kind of very different examples. You can take the approach of being mindful of your emotions, and that could actually help with reducing, or you can also be mindful of your external environment to ground yourself if you need relief from those emotions in that moment, and then you can come back to those emotions. So, starting with the emotions element, and I kind of alluded to some bits and pieces of it. Observe, describe, participate. Observe. I notice that my heart rate is going up, right? And that's part of describe too. Observe, there's not the language yet, so you're just like feeling it. And then the describe would be saying, I notice my heart rate. I notice my hands are getting sweaty, all the different symptoms. And by doing that, being objective in it, you're not labeling, you're not jumping as most people start to do. I'm having a panic attack, I'm going to die. It's just observing, describing. And then you say, okay, participating would be, what do I do with those emotions? What do I, and let me take a step back of describing as well. You might add on the I'm having the thought that I'm going to die. And you might quickly recognize I'm not going to die. That's just a thought. So participating looks a little bit different in that your symptoms might already be going down as a result of accepting. And what's a little bit hard is it's kind of like gradual exposure. In the very beginning, it might be hard for them to do this immediately, to sit with emotions. But what we talk about when it comes to mindfulness of emotions, it's a graduated level of mastery. If you could sit with yourself and say, I'm just observing this and it's just happening. What you'll start noticing is you'll say, my heart rate's going up. And as you notice it and describe it, it will start to come down. Because also your brain is focused on those symptoms without any of those judgments and labels. Now, what I typically start people with is now the second example of being more mindful of your external environment, because the internal one is a bit more difficult. So, what I would have someone do is, as they start to feel anxious, instead of being mindful of their emotions, they would start being to observe and then describe their external environment. I am here. I am in, let's say they're in a classroom setting and they're starting to get anxious. I see the teacher. The teacher is wearing brown. I don't know why I said a teacher is wearing brown. I just picture teachers wearing brown, brown and a tie, whatever it may be. Okay, I see, there's 20 people around me. Then they might be mindful. They might touch their chair and feel the texture of the chair and be mindful. I am here. I am safe. I am present. And they would use their different senses to observe and describe and then participate to be fully grounded as then their anxiety comes down. This is especially helpful for dissociation. It's a very important skill for dissociation because we're overwhelmed by internal emotions and thoughts. And so we could be externally grounded enough for that emotion to come down. And then, of course, you could be mindful of it then and then say, what do I do with that emotion?
From a neurobiological standpoint, I know we've maybe mentioned this in previous episodes, but essentially for those that are interested in this particular thing, kind of understanding why mindfulness works, at least in part why it works. Essentially, what you're doing is you're deactivating the amygdala, the control that the amygdala has over your emotional state. For those that are unaware of what the amygdala does, it primarily plays a role in triggering the fight, flight, or freeze response. And it is often in the state of a threat, it's the thing that's going to be immediate. And so, what we want to do with mindfulness is we're engaging sort of a higher order thinking, the cerebral cortex, particularly the frontal lobe, in order to take the reins back from the amygdala that is maybe going out of control, if you will, right? And so when you engage in these particular practices of observing, describing, and participate, you are essentially trying to steal, the reins back from the amygdala, who has just sort of suddenly taken over and is making all sort of, to stretch an analogy, making all sort of crazy turns that are taking you in directions you don't want to go. And so being present, describing what's going on with you, especially when you're doing it non-judgmentally, will re-engage that frontal cortex, will start to disengage the amygdala. And sometimes the amygdala is going to fight back while you're doing this. And I think you kind of alluded to this, is that oftentimes when people, especially the first few times they do this, things might feel worse, right? In part, it's like the amygdala is not used to you trying to take the reins back, right? It's used to being the one in control when there is a perceived threat, and so it might fight with you more than normal, and you might feel initially worse. And so it's important to be consistent, to keep incorporating these things in order to see long-term benefit. So I know that goes into some of the overall tips, just sort of emphasizing the practice, practice, practice. But are there some other kind of general tips that you can give us that kind of summarize a lot of these things that we've learned?
Some of the ones that I see come up the most is a lot of people get frustrated when they start doing mindfulness practices because
Hmm.
it's not a muscle that they've grown. And so they get
Yeah.
so easily distracted. And so I tell people, first off, part of mindfulness is not judging. So don't judge yourself for not doing it perfectly. Just gently redirect yourself back to whatever you're trying to be mindful of and do it as many times as it takes. And what you'll notice over time is maybe if it takes you, 20 minutes to be mindful of your breath and to finally feel relaxed, over time it'll become 20 to 15, 15 to 10, 10 to 5. And so just be patient with yourself, redirect yourself as needed. Do not be frustrated with yourself. It's a practice that needs to happen in a way that I encourage people to make it a lifestyle. That's another tip. The
Yeah.
more that you do it as a lifestyle, then the more you can utilize it as a skill when it's really needed. And so what I mean by lifestyle, I encourage people do mindful eating. Be mindful of the texture, the flavors of your food. Do mindful breathing, mindful showering, as I mentioned before, as an example, mindful brushing your teeth, small things, big things. And then also, just in general, slow down in life. There's a great book called Ruthless Elimination of Hurry. And there's other ones of like the same idea of like, we are just living at a rushed pace and we need to slow down. So be more mindful in general, have a lifestyle in this way. And then part of that too is I would encourage you to be mindful to kind of ask your friends to adopt this as well. And friends, family, for parents, try to adopt this for your children. And accountability helps with that. And so being more mindful with others as well. You could even do practices such as, hey, let's all agree that when we're at the dinner table, we'll put away our phones, whatever it may be to help with that mindfulness. And then in general, I think nature is a great place to be mindful. Forest bathing, that's a huge thing right now. But in the sense of it's very easy to start practicing with nature. So start with what's easiest. I wouldn't recommend starting with your emotions, being mindful of that. You could, but I would say something that's more concrete and something that nature is so easy because you have all the different five senses there. And plus you have all the benefits that come with that as well. And then again, I just want to encourage our listeners and our watchers to practice, practice, practice. It's not easy, but the more that you do, you're going to be so enriched with being more mindful of the joy in your life and then also of the unpleasant in a way that then you could address it and you'll really see ultimate change in your life.
Yeah, this is, as you said, a lifestyle. It's something that you want to incorporate, something that's going to take time. Many of us will go throughout our entire life being, maybe like you and I, very familiar with these concepts, but always difficult to even achieve mastery for people that are sort of living and breathing this stuff all the time. So as you said, be patient with the process, and be careful not to judge yourself about whether or not you are being mindful enough. It's a constant iteration of getting a little bit better over time. And the last thing I'll say with that is, give yourself grace. We live in a very distracted environment. I think we are all aware of that. And the level of distraction is just rapidly increasing every single year. And so it's going to be an ongoing challenge that I think will become even more and more and more relevant over time. So fight the good fight, so to speak. Take back your attention, practice being present, and you'll look back on your life and feel like you've gotten a whole lot more value out of it. So listeners, we thank you for tuning in today. We hope you got some value out of today's podcast, and go ahead and start incorporating more mindfulness into your day-to-day existence. And you can do so immediately. Right after this podcast ends, if you're driving, go ahead and practice some mindfulness of the podcast. And when you're done, of the road. If you're driving home to your family, try to be more present with the members of your family today and moving forward. So once again, thank you for being part of the Beautiful Minds family, and we look forward to next time.
Thanks for listening. If you enjoyed today's episode, please like and subscribe. Your engagement will help us reach more people who need encouragement. To hear more episodes, learn about our other mental health resources, or support us financially, visit thebrainpeoplepodcast.com.